like to call to order the November 25th meeting of the Health and Education Committee. First order of business is approval of minutes.
So moved.
Second.
All right, all in favor?
Aye.
Community care report. Carol, you want to share that with us? I know it's on our iPads.
Everything's going well.
Okay. How's census?
Census is, I don't remember where it was up just a little bit. Was it up just a little bit?
It's about the same, about 125, so
yeah.
it's staying in that neighborhood every month, really.
Seems like it's strong in the winter.
And he said that all over the state, the nursing homes are not as filling up like they did because it's things that state has done.
To keep people at home. Yeah. Very good. All right.
Mr. Chairman, if you'll read that last paragraph in your minutes, you'll notice there is some beginning discussion how this has happened. I mean, this has been going on for a little bit of time about a master plan for some substantial additions and wings to that building. So as time goes on, you'll hear more about that,
Okay.
and it will be subject to funding being worked out, and it may be that they have to get some permission from the county for them to exercise maybe the authority to even borrow some money. So all of that, just want to say, this is just a brief heads up that over the next several months you may hear more.
Is that an increase in number of beds or just an increase in space?
Well, it'll be the same number of beds basically.
'Cause I know it's a pretty good ordeal to get permission from the
They've
state.
already taken some of their beds out of service, and so this is just a continuing dialogue that's going on about adding some additional wings to replace some of the ones they currently have.
We're licensed for 131 beds.
I know it's a big deal to increase that number.
Yeah,
And that's-
we're not talking about
Yeah.
increasing the number of beds. You have to go through a certificate
Tremendous
of need
exercise.
process through the state of Tennessee, which is very difficult to increase the number. So, but it's just been enhanced and changed a little bit of the philosophy. Some of the buildings will be a bit more independent. It'll be more residential in nature than institutional. So it's a different philosophy being discussed.
Very good. All right.
Make a motion to approve.
Second.
All right, all in favor?
Aye.
All right, Ms. Garrett, Health Department.
Good evening. Okay, so the first thing I have is the Health Department report, and that's this colored one that's on the iPad. Follow up from last month, if you remember, we were still waiting on my dental numbers for the previous month. I didn't get the email with the data, so I did get update to last month. So it was 65 was our number in dental, just right around where we would expect, and then it's 62 this time. So that was just an update from the dental from last time. You'll see immunizations go up always in the winter. We're 2 times during the year, in the winter for flu vaccinations, and then also in the summer with the back to school kids getting their vaccinations. Doing lots of prevention this month. Over 1,500 clients that we saw doing prevention programs, trying to focus on our protect, promote, and improve. Because we know if we can delay that entry into healthcare by keeping people healthier and teaching them preventative ways to stay healthier, then they're less likely to need that improved category till later and come into that category more improved. So we're excited to be showing you those numbers now about those prevention projects and things that we're working on with that.
Do you run into a lot of where the children are lacking in meals?
Occasionally we do. There's quite a few good resources here in our county where we can refer and connect, and we have a good relationship with DHS where we will help them with the SNAP program, and then also through our program, which is WIC. So there's really quite a bit that we can connect them up when I do find a family that's needing that. And then Greenhouse and some of our other food banks that we have in both Smyrna and Laverne and in Murfreesboro are very generous and helpful for our clients that need it.
I'm amazed at the children that don't get food on the weekends and so forth,
Mhm.
and how the community is having to provide it. I don't know what the parents are doing. And I often wonder, why is there so many not fed or not have access to meals?
I know a lot of I know the schools are doing some outreach programs to try to meet that need, that I think are pretty ingenious ways. They've partnered with churches and different things to have backpacks full of foods to go out on the weekends to children, so that they do have food on the weekend, and just having those resources available and trying to connect them with it.
There's a lot of resources in this county that's available. I don't have a brochure on it in my presence, but there's a page of it.
Mhm.
And that's why, and I don't understand it.
What are the, just kind of in that line of thinking, tender care, you have
Yes.
home visits.
Yes.
What are those home visits?
So we do a couple of different kinds of home visits. So we have some under the Tender Care program. That's actually funded by TennCare, and that is targeting children who are not up to date on their well child exams. So when you're under the age of 21 and on TennCare, you're eligible for a free head to toe exam, eye exam, ear exam, dental, everything once a year. More often when you're a baby, but as you get to 1 year old, they get to be yearly that you can have them. And so kids will fall off of that, not come in for their yearly free physical. So these ladies go to the home, talk to mom. They go to doctor's offices, encourage doctors, make sure you try to do the well child exam while they're here, or schedule those. So those home visits are actually going out to children who are on a list that we get from TennCare that says they are not up to date on their EPSD&T, or what we would call well child exam. Early periodic screening, diagnostic and testing is what they call that, the big long name for it. So that's what that home visit. And we also do some home visits through our HUGS program, which is women who are either pregnant or have a child under the age of 5. It's a voluntary program. And we just go through parenting. We connect them to resources, parenting skills, developmental stages, where should the baby be. We assess the area that they live in. Do they have a safe sleep environment? If not, we teach them how. Don't have the baby in the bed. It needs to have its own bed, on its back, alone in the crib, the ABCs of safe sleep. So we have a couple of different home visiting type programs that
Both
focus
under
on
this
this.
heading?
Yes.
On those home visits?
I'm sorry, I missaid. Excuse me, Sally. Is the Tender Care is just the TennCare. Over here under HUGS on the improved
Got it,
side,
yes.
that's the other program that I was speaking of.
I'm just curious if those two numbers on October 14 and year-to-date should be reversed, because you've got larger in October.
On which one, I'm sorry?
Under the home
Home
visits.
visits, the month is greater than the year-to-date.
Oh, that does look like a typo, yeah. I'll check it and get back with you, but I think that probably was a typo.
Okay, any questions on this report? Okay.
Let me ask this, heard this one question, and
Yes, sir.
let's look under administration, under reports. Birth certificates,
Yes, sir.
year-to-date, 4,779. Death certificates, 7,822. Does every birth certificate and every death certificate come through your clinic? I mean,
Right. So no, these birth certificates are people coming in and requesting them.
okay, so
So-
that's not all that were recorded
That's exactly
from
right.
births in Rutherford
Right.
County?
Births in Rutherford County would come out of the state.
Okay.
So those are recorded to the state, and then they get put into a system where you can walk in and request yours, and pay a small fee, and then we'll print that, what's called a short form. You can't use the short form for everything, but you can use it for a lot of things. People need it for job, employment, and
Well, I
that.
was just concerned about death certificates being much larger than birth certificates.
Yes. And death
They should
certificates.
I don't think that's happening
We,
in our county.
we issue, I don't think it is yet. We issue our death certificates for, the funeral homes may come and get them, persons can come and get them. For anyone who passes away in Rutherford County, we'll keep that record for 3 years. If they need other things past that 3 years or what, they can get that from the state vital record office.
Okay.
Now, I got a question for you.
Yes, sir.
On birth certificates, you said the state issues those and designates the county, right? I mean,
Yes, well, there's a form filled out at birth
right,
that tells them what county it came from, so.
came from, okay.
Yes.
So if a person lives in Rutherford County but goes to Nashville,
Right.
would that be designated as a Davidson County, or would it come back and be a Rutherford County birth certificate?
We would be able to print it for them, and it would
Right.
say, I don't know to tell you the truth.
Because
If
it could
says,
be,
yeah,
it could be more,
I
it
believe
would
it's.
affect us in the county, but
Right,
they would get the credit for the birth, I
the
guess.
birth, yeah. I'll have to get back with you, because I don't want to misspeak, but I think that it says the county you were born in.
County you were born
hmm
in. Okay.
And then it'll say resident of mom, resident
Right.
of dad, on there.
Okay, I just wondered where the number went to.
Yeah, and that's for the state vital records. This number here is just purely people who came in of
Okay.
any age and asked for a birth certificate, so that they can have those printed with us.
Including new births?
Yes, it takes a few days.
This is new births plus anyone who came in.
Yes, exactly. Like you could come in tomorrow and
Sure.
get one.
But it's only people who
Yes.
want a copy, but every time a child is born to the hospital, that number doesn't go up right there.
That's exactly right. That number goes to the state
Yeah.
vital records.
This
and
is just what's
Right.
driven by people walking and needing them for.
Okay.
Exactly. This is a
stuff like
service
that.
we provided.
Yeah.
Yes, it's a service we provided for a resident here. Which is really nice because it's not that way in other states. I was born in another state and it's quite difficult to get your birth certificate. Here in Tennessee, they make it relatively easy for you to get a copy of it.
Everything's better when you're born in Tennessee.
That's right.
My marriage certificates. wonder
Any
how
other
many we
questions?
say.
No? Okay, need a motion to approve?
So moved.
Second.
All in favor?
Aye.
Any opposed? Very good. All right, what else you got?
Couple other things, just some good news I wanted to share. I've been talking about the Tennessee Performance Excellence or Baldrige criteria that we've been working on to improve. And so we did find out that we won the Commitment Award, which is the second level on the ream of 4 levels. And so we're really excited about that. And they did a little press release for us, and I thought it was really, this quote was from Governor Bill Haslam. We want to congratulate Rutherford County Health Department on this recognition. Organizations that participate in this award program should show an unwavering commitment to continuous improvement and performance excellence. Our state is a better place to live and work because of organizations like Rutherford County Health Department that are helping to build a better Tennessee. So I just thought that was exciting, and I wanted to share. I had told y'all we were in the process, but I wanted to update you on where we did get our notification of our award.
Congratulations.
Thank you. Thank you. We're very excited to keep improving and doing better. Okay, and in the back of your packet is just a list if you wanted to see who all had won the awards. So over the whole state of Tennessee, there was just these few people, and then it talks about you can see the different agencies. Again, just an FYI, I thought I would share with you. And then I have a couple of contract financial stuff that I need to move forward with you guys to budget and on. So the first one is, the ones who've been on with me for a while know that the state's always about 6 months behind. So this is the budget that you guys approved for our health department back, in June. And they've just now gotten the contract to me to get it signed by Mayor Burgess and all parties. So I need to, and Ms. Nolan's looked at this, is exactly what we agreed to. And so it's just a matter of, I guess, cleaning up paperwork for the state and submitting this. So I need to submit this on.
Can we take them both in one motion?
Yep.
Make a motion to approve both?
Second.
Did you submit a motion, or were you just saying we're gonna make a motion?
Well, I did, I asked, then I said a motion.
Okay.
To approve both
Yeah, approve both.
of these independent contracts or this one budget? I'm sorry.
No, these two,
I think we're looking at this one right now.
This one is the agreement between Tennessee Department of Health and Rutherford. I got 3.
Yeah.
oh, okay,
I have three.
I was jumping ahead to the
Yeah, sorry.
employee part.
Still want to give me a motion?
we go over all three and then do one motion, or is that okay?
Yeah, that works.
It's usually pretty straightforward.
Okay.
Stuff is.
All right.
Withdraw the motion until she gets through.
Okay, thanks.
Thank you, Commissioner. Okay, so the other two contracts are by TCA law. It says that the state can supplement 2 positions of salary for the health department, the director and the medical director. And that is myself and Dr. Naeem Uddin, who is our medical director there. So this is no additional funding for you guys. This is already part of what you send in. They just need this contract to reassign the money to the salary. But it's no additional charges. It's just part of what we already send in as a county to the state, and they realign that to these salaries.
And these are the numbers we had in the budget.
Yes, yes, yeah.
I'll make a motion to approve all 3.
Very good.
I'll second that.
Can we do a roll call?
Commissioner Cook,
Yes.
Commissioner Dodd,
Yes.
Commissioner Jordan,
Yes.
Commissioner Nichols,
Yes.
Commissioner Reed,
Yes.
Commissioner Turner.
Yes.
Commissioner Allen.
Yes.
That's it. Oh, wait, you need a copy, right, of which one, the colored report, right?
You
There
don't
it
want
is. You got those, that one I only wrote the color. The coloring, I try to save it when I can. Thank you, guys.
Thank you.
Special projects, Ms. Jolly?
I don't really have anything to point out. I've just done the usual paying bills and encumbering stuff. So if you have any questions about the report, I'm sure Jeff will be able to answer it.
How long do those projects that have been completed stay on here?
I just noticed
Oh,
the
okay.
Figure one. I need to get that one off.
No,
I'll
that's
have
fine.
that off next time.
No worries.
That should have come off this time.
I don't know how many of you had a chance to tour the Smyrna Primary Edition, but I was able to do that last month, and just so reaffirming as to why we even do this job, to be able to go see that and see those kids using it. And they had students who actually led the tour, and they had each one, they toured us as a group, and so each one had a part that they would present, and it was just incredibly impressive. I was really proud, so thank you for that.
Just fell into time. I couldn't go.
Well, and the school board did also say, I guess we'll bring this up when Jeff comes, but there's also another opportunity to tour some schools coming up, so. Okay. Any questions about Ms. Jolly's report, special projects? Okay.
So moved.
Second.
All right, all in favor?
Aye.
Very good, thank you. Mr. Sandig?
Good evening.
Aye.
I have a building program amendment,
Okay.
and it's cleanup. Taking the remaining, cleaning up the Stewart's Creek High project and taking the remaining $69,639 out of Stewart's Creek High project and setting up a line called High School Project, just a holding place for the money. We went over when I brought the other amendment in August, I believe. We keep the mix of what we have shared and haven't shared with the city clean. That's why I stuck it down there. And then as part of that process too, the middle school amendment for Blackman is taking $324,612 from that project and covering, there's a $4,534 deficit in middle school land, the Whitworth Buchanan Annex land, kind of closing costs and a difference when it was surveyed in number of acres, and then leaves $320,078 for land at the next middle school or middle school annex that the commission approves, keeping that mix right. As we move forward, we may have, as final change orders are issued and all, we might have a little money become available at Stewart's Creek High. We don't know. Right now, there's $83,571 left in Blackman Middle Annex project. We'll probably be amending that, but it's been recent enough since it opened, we didn't want to totally wipe it out. And the deficit with the Smyrna Primary Edition, we may be able to take care of that with a change order, but we're looking at ways to take care of it. We can handle it with the Blackman Middle land, if not with the Blackman Middle Annex funding too. But we'll keeping some options open on that one for right now, till we see the project is a little more near closing. And our recommended motion is to amend the building program budget within project for a total of $69,639 in the Stewart's Creek project. Transfer that $69,639 to an unnamed later high school project, and to transfer $324,612 from the Blackman Middle Annex project to middle school land as presented.
Okay. Any questions about the report or the motion?
I'll make a motion that we approve the amendment as presented.
Second.
Very good. Roll call.
Commissioner Cook?
Yes.
Commissioner Dodd?
Yes.
Commissioner Jordan?
Yes.
Commissioner Nipper?
Yeah.
Commissioner Reed?
Yes.
Commissioner Turner?
Yes.
Commissioner Allen?
Yes.
One of the items that Dana brought up is the backpacks that we sent home. We have federal Atlas funds, and that is the main source for those, but we do get various donations and all to help with that. That is not in the part of the GP budget.
Right.
I thought it was interesting the other night. They had a program on about feeding the children. And Davison County is feeding, well, I understand, all of the children now.
As is Murfreesboro City. Mhm.
Yeah, Murfreesboro City is too. And they said even in the wealthy areas of Davison County, since the children were getting food like they're getting a regular meal, their grades are up.
Mm.
I thought that was of interest.
I didn't see that.
It was one of those late night programs.
I can't stay up late.
But I thought that was of interest.
Well,
And they mentioned out in Belmead and such as that the children's grades are even up. A whole point, a whole letter.
well, we had some discussion of that program last year. Our free and reduced rate overall is enough lower that we don't think it would work financially for us in our system. And there are some options to do individual schools, but then you get into, my child was at this school this year, he moved to another school and
They don't
now
have it.
has to pay.
Equity.
And- Pardon?
Equity.
Equity
Yeah.
and all that, and then the multiplier that the feds are using in this program initially is it's to stay fixed for 3 years, then they project it going down, which is one of the reasons we were not at all sure it was financially viable for our.
Maybe that's why Davison County decided to do it countywide.
But their free and reduced rate is enough higher than ours that.
What I'm thinking though, moving around, they've still got it. See?
Yeah. But our rate again of the number of students in those programs is enough lower that we are not confident would be financially viable. If you don't cover it within your school nutrition program, you take the money out of your GPS budget. So we moved away from that about 10 years ago. So.
I remember some of the discussions, but I just thought it was of interest.
It's an interesting.
Very
program.
interesting
Yeah.
in a metropolitan area, you know.
So Jeff, you've got the John Coleman and Roy Waldron tours planned for December 6th?
Yes. Mhm.
And do you know which one you're going to start at? If people don't want to ride the bus?
No,
from Central
I
Office?
don't. I
Okay.
do not know which one they're going to start at.
Do you know what is the purpose, just so we can see what the needs are in those two schools?
Yes.
They never take us to see a
Yeah.
school in good shape. They always take us to see one in
Maybe we should request that.
I would like to know, because I can drive to John Colton
Yeah.
before I can go to,
Yeah.
come up here.
Well,
See if you can let us know.
I will try to get you an email, Commissioner, if you could
Okay. We'll forward it out. Sure.
forward it to everyone.
And so since you're leaving Central Office at 8:30, I'm assuming you're starting at 9, wherever you're going.
I won't be at that board
Okay.
meeting,
Okay.
so I haven't worried
I
about
got
it.
you. I got you. It's not on your calendar.
Send that to Vicki and
Yeah, she'll let us all
she'll
know.
distribute it to
All
the
right.
committee.
That'd be great. Okay. And then, our December 23rd meeting, we anticipate is not going to be needed unless, Jeff, you tell us that something's come up on the
Right.
11th.
Right.
So,
Okay.
how far, do we need to go ahead and advertise it, or do we?
No,
Yeah.
we only
How
take
far out?
5 days, so.
5 days,
yeah.
okay.
So he can notify you
Okay.
what, if they need any business, and we can set a time.
Okay.
So the meeting is
They're already
tentatively
advertised.
off.
I would say
Yeah.
plan on it being off unless you hear differently.
They're already advertised, so
Okay,
unless
so
you
we're good, we're
move
covered
it,
with that.
there's a problem.
Okay.
Oh, okay.
Very good. So then, assuming we don't meet on December 23rd, then our next meeting is January 27th. Is there any new business for us? Very good. Happy Thanksgiving. We're adjourned.
Merry Christmas.
Thanks, Jim.
You're correct.
Did the Parsons Committee go? Happy New Year.
Jeff,